It starts in silence. No sirens, no warnings, just a sudden shift. A slight droop in the face, a slurred word, a hand that won't quite move the way it should. In that moment, life doesn't pause, it changes. And for older adults, that single moment can mean the difference between a full recovery and a lifetime of challenges. That moment is a stroke, and what happens in the minutes that follow can save the brain or cost it dearly. Many believe that once an ambulance is called, the most important job is done. But the truth is more urgent and more personal. Stroke is a condition where every minute means damage. The longer the brain is without oxygen, the more brain cells die. That damage isn't always reversible. In fact, neurologists often say, time is brain. That's not a metaphor, it's a warning. A 5-minute delay can steal speech, memory, movement, or independence. And yet, in those precious early minutes, so many people do the same thing. They wait. They wait for paramedics, for someone else to act, for the process to begin. But waiting quietly can be the most dangerous choice. Because what you do, or don't do, before the ambulance arrives might determine how much of your brain is still working by the time you reach the hospital. This isn't about fear. It's about knowledge. It's about understanding that stroke isn't just a medical emergency, it's a personal one. And there are small, simple actions that you can take during those early minutes that can protect the brain while help is on the way. If you're over 60, or if you care for someone who is, this information isn't optional, it's essential. Because when stroke strikes, the body doesn't wait. And neither should you. A stroke is not just an old age condition or something that happens out of nowhere. It's a medical event where the blood flow to part of the brain is suddenly interrupted. That interruption, whether from a blocked artery or a ruptured blood vessel, starves the brain of oxygen. And without oxygen, brain cells begin to die within minutes. That's why strokes are considered one of the most urgent emergencies in medicine. Because the longer the delay, the more permanent the damage. There are two main types of stroke. The most common is ischemic stroke, which happens when a blood clot blocks a vessel in the brain. The second is hemorrhagic stroke, which involves bleeding in the brain due to a burst blood vessel. Both types can be life-threatening. But even when they're not fatal, they can leave lasting effects: speech difficulties, memory loss, muscle weakness, and in some cases, total physical dependence. What makes strokes particularly dangerous is that the brain doesn't regenerate the same way other parts of the body do. Unlike a broken bone or a cut on the skin, brain damage from a stroke may never fully heal. That's why early action isn't just helpful, it's critical. The faster treatment begins, the better the chance of saving brain function and avoiding long-term disability. Unfortunately, many people don't recognize what a stroke truly is until it's too late. They may mistake the signs for fatigue, confusion, or even the effects of aging. Others assume the body will bounce back on its own. But when it comes to a stroke, time doesn't forgive those mistakes. The window for effective treatment is small, usually within the first 3 to 4.5 hours from the onset of symptoms. After that, the options become limited and the risks multiply. Understanding what a stroke is doesn't just help you react, it helps you prepare. Because when you know what's happening inside the body, you also begin to understand why every minute matters. And you gain the clarity to act without hesitation when the signs appear. Strokes don't always start with pain. In fact, they often begin quietly, so quietly that many people brush off the first signs as something minor or temporary. But the body always gives a signal, and knowing how to read those signals can mean the difference between a quick recovery and irreversible damage. One of the most widely used tools to spot a stroke is the acronym FAST, F, face. Is one side of the face drooping when the person smiles? Arms. Can they raise both arms, or does one drift downward? S, speech. Is their speech slurred or strange? T, time. If you see any of these signs, it's time to call emergency services immediately. These symptoms may seem small or even harmless at first. A slight imbalance, a word forgotten, a hand that fumbles. But they're not random. They're your body's alarm system. And in someone over 60, these signs must never be ignored, not even for a few minutes. Because every minute lost could mean more brain tissue damaged. Other symptoms can include sudden confusion, blurred or double vision, dizziness, loss of coordination, or a severe headache that appears with no clear cause. Some strokes even affect perception, making it hard for the person to realize something is wrong. That's why it's often family members or caregivers who first notice the change. The danger lies in hesitation. Many people tell themselves, "Let's just wait and see if it passes." That delay is where irreversible harm begins. If there's even a possibility it could be a stroke, taking action immediately is not just the safe choice, it's the only choice. Recognizing these signs gives you power. It turns fear into clarity. It allows you to respond with intention, not panic. And most importantly, it puts you in the position to act during the most critical window, before the brain has time to shut down what it might not get back. Calling an ambulance is absolutely the right first step when a stroke is suspected, but it's not the only step. Many believe that once the call is made, the response is out of their hands. They sit and wait, hoping help arrives quickly. But the reality is, those few minutes before the ambulance shows up are some of the most critical in the entire emergency response. And during that window, what you do, or don't do, can shape the outcome in ways you might not expect. Ambulance teams are trained to respond fast, but delays happen. Traffic, location, and even weather can slow down arrival. In those lost minutes, the brain continues to suffer from lack of oxygen. And while the body appears still, the damage is happening in silence. That's why relying solely on emergency services isn't enough. The care must begin before the sirens are heard. There are simple, low-risk steps that anyone, family, neighbors, even the person experiencing symptoms, can take while waiting. These steps won't replace medical care, but they can buy precious time. They can help protect blood flow, support breathing, and stabilize the body in a way that reduces the chances of complications once medical help arrives. The problem is, most people don't know what those steps are. They've never been taught what to do beyond dialing for help. And in that gap, valuable time is lost. Time that could have been used to reduce swelling, prevent secondary injury, or simply keep the person calm and conscious. Understanding that waiting passively isn't enough doesn't mean panicking. It means preparing. It means knowing, ahead of time, what small, safe actions could support the brain until the professionals take over. Because in stroke response, every single minute either protects or costs the brain. When a stroke hits, the brain is in crisis. Blood flow is disrupted, oxygen is limited, and neurons begin to die. But during those first few minutes, before the ambulance arrives, there's one action that could help slow the damage, gently laying the person down and elevating their head slightly, ideally at a 30-degree angle. This simple position may support circulation, reduce pressure inside the skull, and help the brain manage the trauma while waiting for emergency care. It sounds too basic to make a difference. But here's what medical experts have found. Body position during a stroke can influence blood flow to the brain. Lying completely flat might worsen swelling in the brain. Sitting fully upright could reduce blood pressure too much, further limiting oxygen delivery. But a neutral, slightly elevated head position strikes a balance. It encourages blood flow without increasing pressure. To do this safely, the person should be on their back, with their head and upper body slightly raised. A folded towel, pillow, or cushion behind the upper back and head can provide the right angle. If they're vomiting or having trouble swallowing, gently turn their head to the side to help prevent choking. Don't try to give them food, water, or medications. At this stage, swallowing may be impaired and could cause more harm. It's important to stay calm and speak reassuringly. Stress and panic can raise blood pressure and worsen the situation. Just your voice, your presence, and this one supportive action can create a sense of stability while waiting for the paramedics to arrive. This is not a cure, it's a bridge. A small, non-invasive step that supports the brain's ability to hold on until advanced care begins. It doesn't require equipment or training, just awareness. And in the world of stroke care, awareness can be the most powerful tool you have. Medical science has long emphasized speed in stroke treatment, but in recent years, research has also begun to examine what can be done before treatment begins. Among the most studied factors is body positioning, especially in the very first phase of a stroke. What researchers have found is simple yet powerful. How the body is positioned can directly affect blood flow to the brain and may influence early outcomes. In ischemic strokes, where a blood clot blocks circulation, the brain is starved of oxygen. Maintaining blood flow becomes essential. Studies suggest that a slightly elevated head position can help regulate cerebral blood pressure, preventing a dangerous rise in intracranial pressure while still allowing enough oxygen-rich blood to reach the brain. It's not a treatment in itself, but it supports the body in a fragile moment, buying time until clot-busting drugs or surgical interventions can be administered. In contrast, keeping the head too low or the body entirely flat may worsen swelling or increase the risk of aspiration if the person vomits. On the other hand, sitting the person too upright can lower blood pressure, especially in seniors, and reduce cerebral perfusion. That's why the 30-degree angle has become a recommended middle ground in emergency stroke positioning, a balance between stability and circulation. Clinical guidelines in some hospitals now include early head elevation as part of pre-hospital care when it's safe to do so. It's not a universal protocol yet, but it's gaining recognition, especially as more data links early positioning with improved patient outcomes. Importantly, it's a low-risk action. Unlike medication or invasive intervention, elevating the head carries virtually no harm when done gently, and it can be performed even before medical professionals arrive. Understanding this science gives families and caregivers a quiet form of power. It turns helplessness into action. It allows them to respond in a way that supports the brain's survival while waiting for expert care. And most of all, it shows how even the smallest gesture, grounded in knowledge, can make a meaningful difference when seconds matter most. When stroke strikes, the person experiencing it may not be able to speak, move, or even recognize what's happening. That's why the role of family members and caregivers is so vital. You're not just a witness, you're a potential first responder. And your ability to stay calm, act quickly, and know what to do can save a life or preserve brain function in ways that last a lifetime. The first step is recognizing the signs. As we've discussed earlier, subtle changes in speech, movement, or facial expression must be taken seriously. But just recognizing the symptoms isn't enough. You must also react with confidence. That means calling emergency services immediately, positioning the person correctly, and staying with them until help arrives. These aren't medical skills. They're human skills: attention, care, presence. In that moment, panic is natural, but clarity is more powerful. Speaking calmly, offering reassurance, and gently guiding the person into a safe position shows them they're not alone. And for the brain, that calm environment matters. Elevated stress can increase blood pressure and worsen outcomes. A quiet, steady voice and a clear plan create the safest conditions possible until professionals take over. Many caregivers worry about doing it wrong. But the truth is, doing something informed, however small, is almost always better than doing nothing. Whether it's adjusting the person's posture, noting the exact time symptoms began, or simply relaying accurate information to paramedics, these actions can drastically improve what comes next. Training isn't required to make a life-saving difference. What matters most is awareness and preparation. When families talk about stroke before it happens, when they know what to look for and how to respond, they become a line of defense between the crisis and the care. And that kind of readiness brings peace, not just to the patient, but to everyone who loves them. A stroke often comes without warning. But that doesn't mean you have to be unprepared. In fact, some of the most powerful tools against stroke don't come from the hospital, they come from the home. Creating a stroke-ready environment doesn't require expensive equipment or medical training. It starts with awareness, simple planning, and a willingness to take proactive steps that support quick, effective action when every second matters. The first and most critical step is education. Everyone in the household, spouses, children, caregivers, should know the basic signs of stroke and how to respond. Post a fast stroke sign guide on the fridge. Have emergency numbers clearly visible. Practice how to describe symptoms quickly and clearly to a 911 operator. These may seem like small steps, but in the moment of crisis, they become the difference between action and panic. Another important aspect is accessibility. Make sure the home is easy to navigate for first responders, clear hallways, unlocked entrances, well-lit paths. Keep a basic medical history and list of medications updated and easy to find. Include known allergies and any previous stroke history. These small details save time and help paramedics make safer, faster decisions on the way to the hospital. Environment matters, too. Create a calm space in common areas where someone experiencing a stroke can safely lie down and be supported. Pillows or folded blankets can be kept nearby to help elevate the head if needed. Even things as simple as removing clutter or trip hazards can help in those frantic moments when time is slipping away. But perhaps most important is mindset. Being stroke-ready doesn't mean living in fear. It means living with preparedness. It means knowing that if something does happen, you've already put steps in place to respond with calm and confidence. That preparation doesn't just protect the person at risk, it brings peace of mind to everyone in the home. Because when you're ready, you're not powerless. You're equipped, you're steady, and you're giving your loved one the best possible chance, not just to survive a stroke, but to come through it with strength, dignity, and as much of their life intact as possible.